Hello everybody, welcome to the Focused Acute Medicine Ultrasound Accreditation videos. My name's Nick Smallwood and I'm a consultant in acute medicine. This first video is going to take you through the accreditation process. Focused Acute Medicine Ultrasound, or FAMUS, is the ultrasound standard created by the Society for Acute Medicine. In this talk, I'm going to take you through the training process, talk a little bit about the difference between supervisors and mentors, touch on CPD, and finally talk about the administration process. Everything I'm going to talk about here is available on the website, which is listed at the bottom there, and also in the curriculum pack, which is downloadable and available to any candidates. So to start off with about the training process, we've split FAMUS into 3 practical modules, and they are the thoracic module, the abdominal renal module, and DVT and peripheral vascular access. Overarching all of that is the theory behind what you're going to learn, and that is what we'll focus on first. The theoretical module is first of all composed of attendance and an approved practical course. Now, during pandemic times, we've removed the mandatory requirement to attend a practical course because it's difficult, but we would strongly encourage people to try and attend a course if at all possible, because the skills you learn there are immediately transferable to the training process. And also completion of the online e-learning through the e-learning for health portal, which has an assessment at the end of it. And then probably most importantly, the theory knowledge is demonstrated during your supervised scanning process, where you'll get to talk with your supervisor or mentor about the theory behind the scanning that you're undertaking. As I've already mentioned, there's lots of resources available online, and we have imaging and teaching materials at famus.org.uk. So to talk a little bit about the practical side of the training process, we've split things up into 3 modules, as I mentioned. The first module is the thoracic module, and here I've highlighted the core pathologies that we expect people to have a good understanding of by the time they've gone through the process. And for the thoracic module, this is an understanding of increased lung water, which usually means pulmonary edema, familiarity with consolidated lung and what that looks like, and an understanding of the Shred sign. Be familiar with pleural effusions, and in particular how to site mark for drainage. And we want people to have an understanding about how to rule out pneumothorax. With regards to the abdominal renal module, you will get a clear understanding of how to identify abdominal free fluid, which within medicine is usually ascites, and in particular to think about bladder distension and hydronephrosis, so obstructive uropathies. Finally, the DVT and peripheral vascular module will give you a clear understanding of how to rule in DVT and how to successfully place ultrasound-guided peripheral vascular cannulas. So each practical module is learned through 3 different stages. I've already talked a bit about the theoretical stage, but then you'll move on to supervised practice and finally to mentored practice. So supervised practice involves directly supervised scans by your mentor or supervisor. So this is a real opportunity for you to learn the basics of each scan process and put it into practice. Each scan will be reported individually, but of course you can't use them for clinical decision making unless the supervisor approves your findings. This is an example of the reporting sheets that you'll be using. And down the bottom circled is a box to say that your supervisor or mentor agrees that you are completing supervised practice and that you're suitable to move on to the next stage. And stage 3 is mentored practice. So this is where you've done your supervised scans, you've got a clear understanding of what you're doing, but this is a chance for you to put that into practice in your own time and get a clear exposure to all the different pathologies that we want you to experience. So you still report every single scan with images, and they do need to be reviewed in due course by your supervisor or mentor, but you can do these scans on your own. And this will allow you a chance to get increasing confidence and experience. And as I said, it will allow you to get a chance to see all of the different pathologies that you need to image. And to that end, we've given some suggested timeframes to be able to complete each practical module, and that's what we're going to highlight here. So for the thoracic module, we suggest that you undertake 10 directly supervised scans. A further 30 scans are mentored, so done at your own time, but but all the images reviewed with a mentor or supervisor at a later date. And we think for many people that will take an indicative training time of around 6 months. Next, the abdominal renal module. Again, we anticipate 10 supervised scans are required, a further 30 mentored scans, and this will probably take you of the order of 4 months when you're undertaking this with normal clinical duties. And finally, we have the DVT peripheral vascular module. You need to perform 5 directly supervised scans, and then a further 5 scans, which we anticipate being 10 legs, i.e. you scan both legs at the same time, before you're suitable to be signed off. And you'll need to place a minimum of 5 ultrasound-guided peripheral vascular cannulas. This module may take you approximately 1 month, but of course all of these timings are indicative, so different candidates will learn these all at a different rate. So alongside a certain number of scans, we also recommend that you view each of the core pathologies a certain number of times to ensure that you can recognize them consistently. So this will allow you to understand what normal looks like, but as important, to understand what the abnormal appearances of pathology look like. And this makes sure that you have a suitable experience before you undertake ultrasound-guided procedures, for example. Again, these figures are indicative, but this table will highlight what we think are the minimum numbers of times that you should view pathologies. So in the thoracic module, the numbers are available here. Next, for the abdominal renal module, and finally, for the DVT module. You'll note that we only think you need to see 1 DVT to be proficient in that module, but of course we would hope that you'll be able to visualize a number before you finally get signed off. So just to overview the training process, one of the first things you'll need to do is register with the FAMUS administrator, and that's available through the website. You'll need to attend a course as we've talked about, or certainly undertake the online lectures as here. And you'll need to complete the theoretical training with the e-learning module. And within that time frame, we also would like you to find a FAMUS supervisor, which are all listed on the website, and you can contact them and see if they can overview your training process. Once that's all happened, you'll undertake the training scans with full supervision, and then move on to mentored scans. And when you've completed the requisite number of scans, you can get your modules signed off, and finally submit your training record to the FAMUS administrator. This is only 1 bit of paper that you need to send off to the administrator to finish the training process. The rest of the logbook and training scans are all held locally with you. And finally, once you've done that, you'll achieve accreditation and get a certificate and be added onto the database. We're often asked how prior ultrasound experience fits into all of this, and of course it's really important, and many of you will have experience in lots of different facets of ultrasound. So it can be counted, and probably the most common training program that people have undertaken previously is level 1 thoracic ultrasound, as it used to be known. And this can be counted towards your thoracic experience, but the exact contribution is not going to be set by us. It's something for you to discuss with your supervisor on an individual basis, because some people will have had lots and lots of experience and be very comfortable already with much of the thoracic component, whereas other people would have done few scans a while ago and therefore not be so comfortable. So that's a discussion for you and your supervisor, exactly how much that can count. Regardless of your previous experience, we recommend that you undertake the minimum number of directly supervised scans, because this will mean that you and your supervisor or mentor will be able to ensure that you understand exactly what the FAMUS accreditation process involves. So once you've completed the individual practical modules, you'll come to the assessment of completion of training. And this is undertaken once your mentor or supervisor feels that you've completed all the curriculum components and experienced all of the minimum core pathologies. If you're successful with this ACT, it confirms your competency in that part of the curriculum, and it means that you can then go on and scan independently in that area of practice. So it's effectively a sign-off for each individual practical module. And once you're signed off for each of the practical modules, you can undertake your summary of training record. Now, this has to be signed by your supervisor only, and this is the only thing that's returned to the FAMUS administrator. Once that's signed and returned to the FAMUS administrator, you'll be approved and accredited and put onto the SAM database. Now, it's important we just talk a little bit about the difference between supervisor mentors, because with all of the ultrasound accreditations, there's slightly different meanings for these. So within the FAMUS process, we talk about supervisors as people who are registered with the Society for Acute Medicine. They're competent in all areas of the curriculum, and they can sign off all of the paperwork, and they must sign off the summary of training record. Mentors are locally agreed clinicians that your supervisor approves of, and they will be competent in individual areas of the curriculum. So a sonographer, a vascular sonographer example, will be a perfect mentor for the DVT components, and most sonographers will be perfectly competent mentors to undertake the abdominal, renal and DVT components. So these are approved locally, they don't have to be approved through SAM or signed off, and they can sign off all of the paperwork except the summary of training record. So a mentor can take you through a whole practical module from start to finish, and they can sign you off at the end of it, but the whole accreditation process can only be signed off by a supervisor. So just to briefly talk about continuing professional development. As with any practical skill, it's important that you have ongoing experience to maintain your competence through practice. With regards to FAMUS accreditation, we recommend a 3-yearly submission to the FAMUS administrator to maintain your accreditation. So this is you saying that you're continuing to scan regularly and that you're undertaking a minimum number of scans, which we recommend of the order of 20 thoracic scans, 20 abdominal renal scans, and 10 DVT scans per year. And this can either be individual scans or scans that you're supervising or mentoring for people going through the process. The administration of all of this is run through the Society for Acute Medicine, and the email address is on the screen there, famus@acutemedicine.org.uk. As I've mentioned, candidates have got to register and pay the administration fee, and supervisors will also be registered through that process. All of the details are available on the website, and that again is listed on the screen. The last thing for me to mention is that there's lots of resources available, many of which you'll already be aware of. The first of these is the curriculum pack, which is downloadable from the website, and you may well have already seen. This contains everything I've already talked about. There's also a FAMUS handbook, which course attendees will be given as a standard part of their course attendance process, and again underlies more of the detail of the theory behind all of these modules. And there's the Society for Acute Medicine and FAMUS websites, both of which are accessible and free with lots of resources. Finally, for cines and examples of pathologies and normal scans, there's the FAMUS YouTube channel, which is available if you go to YouTube and search Focused Acute Medicine Ultrasound. Thank you for listening. That takes you through the accreditation process for FAMUS. We now have some further videos on the individual practical modules and how to accredit in them.